I hate, with a burning passion in my soul, politics, but I love board games, especially ones that I'm really good at. And I was looking for any excuse to bust out an old favorite. Where's the box, child? We're gonna go down memory lane here. You remember the game Operation, right?
I'm about to pull you. Operation. Remove the pieces and collect your fee, but don't touch the sides.
What better game to play? Well, I explain a little bit about why healthcare is such a big issue in politics. Let's read, child, the instructions, because Lord knows how to win. We like to win. Make money by removing ailments from the game board without getting buzzed. I hate that sound. Whoever collects the most money wins. I feel like I'm set up to win here. Okay, so when you get a big medical bill in the mail, you may think that's the objective of the healthcare industry in the US too. Make the most money. And I'm sure you've seen the comparisons that show we pay more money for healthcare than any other country, or how the healthcare industry is the most profitable industry in the US. And you've heard the stories about the outrageous bills people get, or how people can't afford to get the medical care they need, or how people go into tons of debt because they need to go to the ER. And it's the idea about money. How much healthcare should cost, who should pay, who should profit, what to do when people can't afford care. That's had both sides of the aisle arguing for decades.
The function of a rational healthcare system is not to make the pharmaceutical industry and the drug companies rich. It is to provide health care to all people as a human right, not a privilege.
Mr. Vice President,
no premiums,
you got it.
no
Mr. Vice President,
co-payments, no deductibles.
Let's go.
And the big argument has always been, how should we pay for health care? Right now, it's mainly done through a really confusing system of health insurance.
Health insurance is your ticket to health care in the United States. So, and everybody needs it. Not everybody has it, but everybody needs it.
So let's assume Cavity Sam here, who hopefully is in one piece by the end of this, let's assume that he does not have insurance. So he doesn't have anyone to advocate for him or negotiate the cost of his procedures. So he's on the hook for whatever my made-up hospital decides to charge. People without insurance pay the most for healthcare. One study found they pay 4 times as much as someone with Medicare. So let's say our first surgery here is I have to remove the water on the knee. So let's put on our surgical hat here, ladies. Ooh. Is it gonna come out? Out. Surgery. Done. So, just to remove that would cost, let's go to our price list here. That little thing there, $500 just for that. But then let's say we also want to remove the funny bone. Yeah, I gotta find it first. There it is. Okay. I'm a smart person. So just to remove his funny bone, we gotta check our prices here. That one, $400. And what makes this all so confusing is that my hospital here, I don't have to charge this. I could charge a higher price than the hospital right down the street. But you may not know that or have time to research prices because, in case you forgot, it's an emergency. So if you need an emergency funny bone removal, you don't have that kind of time. And there's very little Cavity Sam here would be able to do about how much I'm charging.
Patients really don't have, they just don't. They don't have any power to change the prices that doctors and hospitals and labs and drug companies charge them.
But what if Cavity Sam was on Medicare? That's a health insurance program from the federal government, and it's mainly used by people 65 and older. And in most cases, it covers hospital stays without charging a monthly premium. And there's another plan where most people pay about $150 a month for medical insurance that covers things like doctor's visits. There's also Medicaid, which is run by individual states and allows some people who can't afford health insurance to get it. And patients with Medicare and Medicaid usually pay less for services than people with private insurance or no insurance. That's because 44 million people, that's 15% of the US, use Medicare according to AARP. And that means the government can tell hospitals how much they're willing to pay. And if they say no, then the hospital loses a lot of business. So let's look at the price of removing Cavity Sam's breadbasket. So that's my cue to get back to work on Sam. We're doing better than we thought. Oh, Sam, I'm so sorry that I'm your surgeon today. That's a winner. Let's go back to my list of prices at my hospital here. So, ooh, this is cha-ching. $1,000 for the breadbasket. So the government can say, we aren't going to pay more than $500 for a breadbasket removal, and hospitals say yes, because they have to. But there are about 1,000 private health insurance companies out there, some with a much smaller group of customers. They negotiate with the hospitals as well, but smaller ones don't have a lot of bargaining power since they don't have as big of a share of the patients. That means they don't have the same amount of leverage when the hospital says, we won't accept any less than $800. So Cavity Sam here ends up paying more if he has insurance through a smaller insurer than if he had a Medicare policy, or if his job offered him a policy through a big insurer with a lot of leverage.
We have fantastic doctors and hospitals who will take great care of you. But it's harder to get to that if you can't afford to pay for it, and it's really hard to afford to pay for it if you don't have health insurance.
So how do we make this less confusing here? I would love to know. Well, a lot of Democrats, like Bernie Sanders, for example, like the idea of this thing called Medicare for all, or a single payer system. That means the government would set all the prices and decide how much to pay for things like getting rid of butterflies in your stomach or fixing up a wrenched ankle. But there's a lot of people who don't like that. They say it would cost too much, make the quality of care worse, and increase the amount of time it would take to get a doctor's appointment. And Joe Biden doesn't support it either. His plan is something called a public option, where anyone can enroll in something like Medicare if they don't like their private insurance, but it wouldn't get rid of private insurance either. The Heritage Foundation, which is a conservative think tank, says a public option like what Joe Biden is proposing would end up leading to a single payer system, which would reduce the amount of choices Americans have when it comes to their health care and stifle competition among doctors, hospitals, and insurers who should be competing to give people the best care at the lowest cost. Now, we should mention that hospitals also don't like the plan. They say public programs like Medicare and Medicaid don't pay providers enough to cover the cost of health care. The American Hospital Association says in 2017, underpayments from these programs totaled more than $75 billion because the government only pays between 85% to 90% of the cost. Donald Trump, on the other hand, has pushed for the repeal of the Affordable Care Act, saying he would replace it with something terrific.
You're saying Obamacare,
it's got to go.
It's got to go.
Repeal and replace with something terrific.
Back in July, he said in an interview that he would enact a new health care plan in early August, but that hasn't happened yet.
Excuse me, you heard me yesterday. We're signing a health care plan within 2 weeks. A full and complete health care plan.
I think the big question for the election is, do people want to build on the law that we have now, the Affordable Care Act, expand the financial assistance, make it more available to more people, expand, navigator assistance, open enrollment, make it easier to sign up, more affordable to sign up? Or do you want that repealed and to be replaced with, it's not clear what?
But here is something that is not so confusing. Hospitals are making a lot of money. According to a study from Health Affairs back in 2013, hospitals were coming out hundreds of millions of dollars ahead. And a report last year found that in most of the largest nonprofit hospitals, executives were paid more than $1 million a year, and some were paid more than $21 million. And it doesn't stop with hospitals. Insurers are raking in money too. Analysis from Modern Healthcare found the 7 biggest publicly traded insurers made almost $1 trillion in 2019. And if you've been making all of this money for years, you wouldn't want anyone changing the rules of the game, right? That's why the healthcare industry spends more money on lobbying Congress than almost any other sector. The Center for Responsive Politics shows spending for healthcare lobbying reached a 10-year high last year, more than $600 million. So what can you do about all of this?
If you have insurance, the first thing to do, everybody hates this, but call that number on the back of your card, get yourself a drink, listen to the hold music, and wait for somebody to come on, and then start asking questions. Why didn't you cover this bill? Can you take another look at it? I think this should have been covered, or I don't see why you hit me with such a big copay or deductible. So don't take no for an answer. If your insurance company says it's not going to pay, call and ask them why, and also call the doctor or hospital and say, please stop your clock while I look into this. Usually they'll do that for you. And then if it still won't pay and you still can't afford it, that's when you have to call back the doctor or the hospital and ask them as nicely as you can, could you please forgive some or all of this bill, or give me a payment plan or something, but I just don't have the money. And that's kind of the best that you have.
But it's up to you to do all of those things until Washington figures out what to do about our confusing healthcare system. And it won't be easy, because after all, the object of the game is to make the most money.